In this lecture, we are going to discuss different drugs that are used in the treatment of the hepatitis B. But important thing which you have to remember, these drugs just stop the replication of the hepatitis B virus. So it means that when someone discontinued uh, taking these drugs, then ultimately hepatitis B virus can be reactivated again in the future. But the question is, then why we use these drugs in the treatment of the hepatitis B? Because it prevents from the severe complications like the liver inflammations, like the cirrhosis, and like the hepatocellular carcinoma. So that is the important thing which you have to remember about these drugs. So first drug is the tenofovir. Tenofovir has two versions: tenofovir disoproxil fumarate TDF, and its brand name is Virid. And second version is the tenofovir alafenamide TAF, and its brand name is Vamlidi. Second drug is the Entecavir, and its brand name is Baraclute. Third is the Lamivudine, and its brand name is Apivir HPV. Fourth is the Adefovir dipivoxil, and its brand name is Hepzira. Next is the Lamivudine, and its brand name is Tyzica. These all drugs are nucleoside analog, and they ultimately inhibit the reverse transcriptase enzyme that helps in the convergence of the RNA into the DNA in the hepatitis B virus. And last is the pegylated interferon alpha 2A, and its brand name is Pegasus. This drug has different mechanism of action, so we will discuss this later. First of all, we will discuss the mechanism of the nucleoside analogs. All drugs are nucleoside analog except PEG interferon alpha. First of all, we will see the difference between the nucleoside and the nucleotide. Nucleoside and the nucleotide. Nucleoside. In the DNA, you will see sugar and the base. When this sugar attached to just base, then it will become the nucleoside. So base can be adenine, thymine, guanine, and the cytosine. Adenine will be in front of the thymine with the double bond, and guanine will be in front of the cytosine with the triple bond. Next, nucleotide. Sugar, base, and if we add the phosphate group, then it will become the nucleotide. So again in the base, you will see. Now in that case, that will become adenine will become the adenosine. Thymine will become the thymidine. Guanine will become the guanosine. Cytosine will become the cytidine. So here is the nitrogenous base, and it will become the nucleotide. Then we change the name of the nitrogenous base. So in the hepatitis B virus, you will see the conversion of the RNA into DNA with the enzyme that is called the reverse transcriptase, also known as RNA dependent DNA polymerase enzyme. Okay. Now this enzyme form the DNA. Now for the formations of the DNA, this enzyme has to collects lot of different nucleotides that are already present in our cells. Okay. Now you will see the structure of the DNA. In the structure of the DNA, you will see the sugar, phosphate, sugar, phosphate, sugar, sugar, phosphate backbone at both sides, and in between the backbone, you will see the adenine that will be in front of the thymine, guanine that will be in front of the cytosine. So that will happen with the help of the reverse transcriptase. So reverse transcriptase, here is the reverse transcriptase that will mistakenly take these drugs, because these drugs are just similar to the nucleotide. But important thing, these drugs are nucleoside. Nucleoside, it means that there is no phosphate present in it. First of all, in the cell, these drugs will become into the nucleotide when we add the phosphate group. Then ultimately these drugs will become active, and these drugs will act similar to the natural nucleotide present in it. So it means that um, reverse transcriptase has two options. It can bind with the drug or that are similar to the nucleotide, or it will bind to the actual or natural nucleotide that are present in the cells. So ultimately you will see the elongation of the chain. When this enzyme mistakenly take the nucleoside analog, I means drugs, then ultimately you will see the stoppage in the elongation. Then ultimately this enzyme will not bind any other natural nucleotide. So that is the important thing. You have to remember reverse transcriptase has two options, that can bind to the natural nucleotide and that can bind to the drugs that are also similar to the natural nucleotide. So but the drugs will stop the elongation of the DNA. When there is stoppage in the replication of the DNA, then ultimately there will be no replication happens in the cells of the liver. So that is the important mechanism of the nucleoside analog. And last, that is the pegylated interferon alpha 2A. These drugs activate the immune system, and these drugs also activate the ribonuclease that ultimately destroy the messenger RNA of the hepatitis B virus. So this is the different mechanism as compared to the other drugs. If we look at the different adverse effects, so first is the tenofovir. Tenofovir, you will see the adverse effect related to the tenofovir will be the nephrotoxicity that will affect the kidney, bone minerals, decrease in the bone minerals, and ultimately you can also see the GI disturbance that is related to the tenofovir, Virid and Vimlidy. Second is the Entecavir. You can see related to the headache, fatigue, and the dizziness. Next is the Lamivudine, that is the well-tolerated HBV drug. And rare cases you can see the pancreatitis related to the Lamivudine. Next is the Adefovir. Adefovir, you can see the nephrotoxicity, headache, and the GI disturbances. And last, PEG interferon alpha, in which you will see the flu-like symptoms like the headache, chills, myalgia, arthralgia. Neurotoxicity. In that case, you will see the somnolence, its state of being drowsiness in that case, and you can also see the behavior disturbances caused by the PEG interferon alpha. You can also see the bone marrow suppression, and ultimately you will see the cytopenia in that case. And you can also see the autoimmune disorders like the thyroiditis. So these are the different adverse effects related to the drugs that are used in the treatment of the hepatitis B virus. But if you still have any question, you may ask in the comment section. Thank you so much.